Good morning everyone, my name is Martina and I will present my project Personalized Diabetes Treatment Decisions in Primary Care, Current Practice and Needs for Change. So to start, the incidence of type 2 diabetes is increasing and the number of patients is estimated to be up to 642 million in 2040. And many of these patients are older and frail, that means that they have many comorbidities. The treatment of diabetes is also changing. There are more treatment options available. The guidelines recommend personalized treatment targets depending on patient characteristics, and the patients want to be more involved in treatment decisions and are more interested in their health. But every drug is not appropriate for everybody, and that's where personalized medicine comes in. It means that different patients have different side effects, they have different preferences. Every drug is not going to be effective for everybody, and they also have different patient characteristics that have to be taken into account when prescribing. So the objective of my project was how can we improve personalized treatment in primary care. And more in detail, we were wondering if personalized medicine is already implemented in clinical practice and how this changes over the years. If there are differences in biomarkers and treatment between older and younger patients, frail and those that are more fit, men and women. If some patients experience more unfavorable side effects. Or how can we support the patient involvement and incorporate their preferences in treatment decisions with general practitioners? The current studies we have conducted, we looked at the treatment of blood glucose and blood pressure in a time period when personalized treatment targets became available in the guidelines. And we saw that the personalized treatment was not clearly visible yet, and it takes a long time to implement new guidelines into clinical practice. Then we looked at the effect of age, sex and the number of co-medication on the occurrence of side effects that are related to low blood pressure, such as hypertension. And we saw that the older patients, women and patients prescribed more medication had more side effects. Last, we looked at the sex and age differences in blood lipid levels, so blood cholesterols and triglycerides, and we saw that women have more favorable blood lipid levels before the age of 50, but after menopause, this changes. For all these studies, we used the GIANT database, which is a big database which contains more than 60,000 type 2 diabetes patients from primary care in the northern Netherlands. So to conclude, we are trying to achieve that the right drug is prescribed to the right patient at the right dose, via the right route, at the right time. For results of my next project, you will have to wait until the final symposia. I would like to thank you for your attention, and in case of any questions, you can contact me on my email.